5 minutes after 10 o'clock. Thank you for tuning in this first day of December. Wow. Somebody posted on Facebook a video of Tina Turner, the singer, getting out of a limousine.
Wow.
Her birthday was November 26th. She just turned 77 years old, and I think this was just like a week or so ago. So she gets out of the limousine, and she is strutting with her beautiful legs at 76, 77 now, Robin.
Yeah, she's beautiful and gorgeous.
And this, for me, was the year of the legs, because this year I had to go and have a lot of things done to the veins inside my legs. And, there was a period of time I think, oh, my gosh, I got to make sure I take care of this because I don't want to not be able to walk. Tish Moeller here, she had some knee replacement stuff done, I think. I don't want to speak out of line, but she had something with her knees. Whenever we speak to Mark Shaw over at Dr. Juan Yordan's office down in the Villages, I listen. I don't know if he knows this, but I listen real carefully because a lot of what he says, I'm taking like mental notes, thinking I got to maybe look into this myself, So let's talk to him right now. Mark is on the phone. He represents Dr. Juan Yordan down in the Villages. Among other things, they talk about medical weight loss. I could use that too, by the way. But the platelet-rich plasma is the thing that always gets my attention because that's how they're treating some people with knee and other joint problems. Good morning, Mark. How are you?
Good morning, Larry. How are you?
I'm all right. Have you seen Tina Turner lately? She's unbelievable.
Buddy,
she's fabulous.
I have, along with Tina Turner and many, many other athletes and professionals who, whether they're on stage or whether they're professional golfers or football players or baseball players, you're starting to see, for example, in recent years, players going longer in their professional NFL, Major League Baseball careers and so on, and it's because of platelet-rich plasma and stem cell. That is the reason why they're getting more longevity than they did. Obviously everybody knows football's a very violent game.
Right. So
it used to be your average career was 4, 5, maybe 6 years. Now you're seeing players increasing those years, 12, 13, 14 years in the NFL at a physical position like a lineman. And they're able to do that because the regenerative properties of this wonderful product that our body produces called platelet-rich plasma.
Okay, so there's also a story this morning. Tiger Woods is going to be golfing again today. Just 1 year ago, everybody thought he was never going to play again because he had 2 back surgeries.
That's correct.
All right, so the one common element between Tina Turner, I think, and Tiger Woods, I'm sure, and a lot of the NFL guys is they've got lots of money. So I'm guessing that the average person reads these stories and says, well,
I can't afford it.
I can't.
Exactly.
I'm sure they can do it, but I can't do it. But you've told us really that you can do it, right?
You absolutely can. If you come see us, first and foremost, Larry, your consultation to sit down with us is completely free. Okay, we don't charge you anything for you to come into our office, and if it's a knee, if it's a hip, myself, our practitioner Charlie, who's been on the air with you as well. Okay, he's in Monroe Regional right now, working. But when he's there with us, we will sit down, we will do an evaluation with you, and make sure that you are a proper candidate to receive platelet-rich plasma. Once we've done that, you fall within the 90 percentile group, meaning if you don't have the contradicting indications, if you don't smoke, if you don't have those kind of things, you're going to get 85% regeneration of that area. That's what's going to happen. And that's what we've seen when we go through our protocols and we do the things the right way at Dr. Yordan's office, that once that's happened, you're definitely going to get the results. But more importantly to that, even though that consultation is free, then at that point, because of our foundation, because of everything that we have, I've got $60 million to lend out to our patients at no credit check, no interest, okay? No interest to you whatsoever. This is not like a credit card. This is not like a bank coming in and saying, okay, yes, we'll pay for it. We come in, we pay for the services up front of whatever it is you need. Let's just say it's $1,500, okay? And that's totally an arbitrary number. It can be as little as $500, Larry. It can be as little as much as $5,000.
Wow.
But it's dependent on
either way. Even 5,000 sounds good, though. I mean, if we're talking about walking again, yeah.
But think about this, Larry. After that, okay, I sit down and I say with you, okay, Larry, you owe $1,500. What can you afford to pay on a weekly basis? Can you afford $25 a week? Great, no problem. Then we're going to do that for the next however many weeks until it takes care of $1,500, or for the next 15 months. That's roughly $100 a month.
Wow.
For 15 months, no interest, straight payments. There it is. You get to pay that off, $100 a month, and you can now walk again. And your treatments and everything are handled.
For the listeners who are listening, I want you to know, first of all, if you've listened to me and Robin forever, you know that we don't try to pull the wool over you because we know we can't. We know you see right through us. This is not an infomercial. Well, it is in a sense, in the fact that Dr. Yordan's office does pay for the time.
Yes.
But that's about it.
Mm-hmm.
Dr. Yordan's office is here, not in far away place, and it's right here in the villages, right here in our area. So, and as Mark mentioned, Charles Brooks is currently at what did you say, Monroe?
Monroe.
At Monroe.
He's at Monroe. Yep.
Yeah. Okay. Mm-hmm. And Dr. Yordan has been a family physician for how many years?
Many years. I mean, he was in Ocala, I think, for like 10 years.
Yeah.
And then has been moved around several places, and then has finally going to take his practice and stay there in the villages. And a lot of people know him in Ocala as well because he's a great physician. I mean, he is a great family doctor. He deals with diabetes. He deals geriatric care. I mean, he is a fantastic doctor, and he really takes care of his patients.
Sometimes people start hurting and they feel like, okay, this is going to go away. It's not serious. I'm going to try to take care of it myself. When should they try not to do that and to come see you?
Okay, so if you've had any kind of traumatic injury, obviously, if you've had a trauma to an area, you sprained a knee, you twisted it, you pulled something, you lifted something with your back, and now it's hurt and everything else, or we're in a car accident, or any of those types of things. Obviously, you've done something to damage it. It's not your day-to-day normal routine. I would say don't self-medicate, with your Advil and your ice pack and your everything else. If it's a free consultation to you, come see Charlie and myself. I mean, it's not going to hurt anything. If for any reason that it's not in the realm of the area that we can help you, the other thing that we do, Larry, is we'll refer you to the correct doctor. We refer and in with a lot of people, from back braces to knee braces to different types of things that can alleviate things that are covered by your insurance that can alleviate that pain. But we save you a lot of time, a lot of effort. I can't tell you how many patients have come to me and, well, I've been to this doctor, that doctor, I've tried this, I've tried that, I've done this, I've tried everything, and I haven't gotten any results. And that's a lot of frustration on a lot of people's part is, how do you know who to go to and when and where and everything else?
Right, I know, and just having the guidance alone is a really big help for almost all of us. The one thing we were talking,
and that's what we would do, Larry. Charlie and I would do that for your listeners as well. They come in, they see us, it's free. If for any reason it's not our area, I'm going to say, okay, here's a name and a number, and you're referred by us, and we're going to send you directly to that doctor, and they'll be able to handle it.
Mark, this morning we were talking about the fact that you were coming on, and I mentioned that there's one part of this that never has really sunk in, and so two things I'm going to ask you, just excuse me for bringing something up that I've probably asked before. Platelet-rich plasma, is it the same thing or a similar thing to stem cells?
Okay, it's not the same thing as stem cells. I mean, you have stem cells, okay, in your body right now, Larry, okay? And when I pull those and draw those out with a needle, okay, they're in with your blood, okay, and with platelets with white blood cells, red blood cells, all the regenerative properties are there in your blood. When I spin that down in a centrifuge, okay, I'm separating those in that vial of blood to where I've got stem cells, regenerative properties, white blood cells, things like that. I draw off with the needle, and the rest I do away with. Okay, so just those regenerative properties. Okay, When you get stem cells, okay, you're getting stem cells from an umbilical cord of a fetus, okay, and it's not someone that's died. It's not a live fetus or anything else. It's mothers give birth, and they have an umbilical cord. If they don't utilize it, those umbilical cords are packed just chock full of stem cells, okay, and they're going to pull those stem cells out of there. Then they're going to freeze them because they have to be shipped to wherever you're going to do it, like down here to Ocala. They will ship it to us, and we have to have it frozen and kept a certain way, and then we're going to thaw that out, and we're going to put that into a needle and inject that into the area that you want, okay? So both processes involve you're actually getting stem cell. With PRP, you're getting your own. Does that make sense?
So it is stem cells, but it's a different way of getting them.
Yeah, it's just yours.
It's your own.
It's your own. Right. Okay. Versus getting it from, an umbilical cord or somewhere else. That's all.
And do you do both knees at the same time or both ankles? And what do you?
Right. So let's say you have a bad knee, Larry. Okay, or bad knees. All right. You'd come in, and that's the reason why we make everything so affordable. You just literally simply tell us, what can you afford to pay on a weekly basis? I mean, what can you afford, $25 a week, 100, I keep using that because, that's just round numbers. Whatever you can afford, get the procedures that you need and listen to what Charlie or Dr. Yordan has to say, because they're telling you the truth. If I were to fix one knee, okay, and you were to try to cost save and I'm just going to fix this one knee.
Right, yeah,
well, now you take the weight while that one's healing, and you put it all over here on this other one, okay, and it causes that one to go bad and get worse.
So can you
understand? So it makes sense to do them both at the same time, so that they heal both at the same time, and then you walk with both your knees at the same time.
We'll take a little break, and on the other side of the break, maybe I could put you on the spot a little bit and ask you if you, with words, could create almost like an animated visual of what actually happens inside the knee, just maybe so that we can visually see it. And
absolutely.
And also for the listeners, I want you to know that the phone lines are open, and we would love if you have a question. And if nothing else, share this interview, because we will put a podcast of it up on the internet, on YouTube and on Facebook. All right, let's take
very much. Would love people to call in.
Yeah, definitely call in. The number is 622-9622. The number down at Dr. Yordan's office is what is the number, Mark?
It's 352-633-0473. Just let Desiree know that you'd like to have a consultation with the PRP or weight loss department, and that would be us.
All right. We have a few phone calls. Let me answer one. I don't have you on the air yet, but if you can hear me, then you're up next. We will take a little break and be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Some fog patches early Thursday, otherwise variable cloudiness with a shower or two and a high anywhere from the mid-70s in the northern part of the zone to the mid-80s in the southernmost part. Thursday night will turn out partly cloudy, anywhere from the mid-40s in the coldest interior spots to the low 60s along the coast. Friday will be partly sunny and not as warm with a high of 69 to 73. Saturday partly sunny, high 73 to 77. From the Florida Weather Center, I'm Joe Lundberg.
'Twas the night before Christmas, and all through the house, not a toilet was flushing. The plumbing was out. The stockings were dirty, no water to clean. We were in a big mess with no washing machine. The children were nestled all snug in their beds, while visions of showers danced in their heads. And Mama in her kerchief and I in my cap, I searched for my tools to try and fix the mishap. When up in the attic there arose such a clatter. The pipes had burst. I see what's the matter. Away to the phone I flew like a flash to call Mike Scott Plumbing. They'll be here in a dash. He arrived in his van and got the job done, for he knew down the road he had more to come. But I heard him exclaim as he drove out of sight, "Merry Christmas to all, and to all a good night." Because accidents don't work around your schedule, but we do, with no extra fees for nights, weekends, or holidays. From all of us at Mike Scott Plumbing, happy holidays.
Next Generation MD is the future of healthcare now. Listen in the first and third Thursday at 10 a.m. to learn how the future in PRP treatments are here in our area. Find out the many ways that Dr. Juan Yordan, MD, Charles Brooks, NP, and case manager Mark Shaw have brought the family medicine practice to a new level. Hear from the very people that benefit from the fine work they have done in this field. Next Generation MD every first and third Thursday at 10 a.m. here on WOCA 96.3 FM, 1370 AM, The Source.
Stay informed on everything going on in the Villages with the Village Spectator newspaper. The Village Spectator is exclusively devoted to the Villages with news, commentary, and more. And yes, they have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company that fits your needs, and all we ask is that you tell them where you heard about them. Call Tom's Picks at 804-1223 and pick up your copy of the Village Spectator today.
Now read Ocala Downtown newspaper online.
All right, 20 minutes after 10 o'clock. I love this conversation we have with Mark because, like I say, I'm just a radio guy, but, we speak to so many professionals and we read so many articles, news articles, and every time something comes up about medical advances, it seems the one that always gets, is the most amazing to me is the stem cell ones. And if you have them in your own body and they can extract them and put them back in and repair things, this is really groundbreaking. And the fact that we have it right here in the Villages is outstanding. Mark, thank you for waiting through the break. You do have a listener call waiting. Again, Mark Shaw is from Dr. Juan C. Yordan's office down in the Villages. Good morning. You're on the air with Mark Shaw.
Yes. Good morning, Mark. Good morning, everybody. I'm going to try to make this short. 24 years ago, I cut my thumb at work. On my left thumb, it's over the second joint, and it's stitched up. It was pretty big. Up to the day, it would still hurt if I touched it. But right now, inside that wound, it's hurting so bad where I can't even handle anything anymore with the left hand. Every day I grab it, just gives and it drops. It makes me drop it. I'm wanting to know if that PRP treatment will work for me.
Well, that's a great question. First and foremost, on that particular type, because you had a wound there, okay? You're going to have what's called scar tissue and different things there that are touching nerves and absolutely causing pain in your hand. We can inject and we can do that with your hand and help those areas regenerate back to before they were wounded. Okay. Some areas that you may have some difficulty is if you cut yourself so deep that it was cut through nerves and things like that don't really repair. Then you have to step into the realm of stem cells. Okay? And that being the case, it's a little more expensive, but yes, you can get great results. We had Marianne on the radio several shows ago, I guess, Larry, it was, that she had a back surgery where they cut nerves. They'd been to the Mayo Clinic, and she had lost feeling all down the side of her leg. She came in. She had a PRP treatment with Charlie. She then had a stem cell, and then a PRP treatment after that. By that third PRP treatment, she had already started to get the tingling, like when your leg goes numb on you, and the blood loss, and it starts to tingle like that. So she already had that going, and she had cut her gabapentin, which is a neuropathy pain medication, very similar to the pain that this man would be feeling. Okay. She had cut that pain medication down from 4 times a day down to 1. She is now no gabapentin and has taken a trip to China and is absolutely feeling much, much better. Yeah. So it is a possibility, yes.
I had a couple cortisone shots that they injected, and they of course, they work, but it's only a temporary thing. They only work a couple months, and after that, it's gone again. Now
what I will tell you is if you've had cortisone shots in that joint and in that area in the last 2 to 3 months, then we need to wait about another month. I mean, if it was 5 months ago, it's totally fine. But the rule of thumb is you need to have it at least 3 months since you've had a cortisone shot in that area. before we actually go in and inject PRP and stem cell and that kind of stuff, because the cortisone actually counteracts the inflammatory process of what we want to happen, so that area starts to regenerate and heal.
Okay, I'm sorry.
It's been about 8 months since I did the cortisone shot, and that previous to that, Dr. Jordan put one in. That's 10 years ago when he was back in Ocala. And I need to find out another thing. You guys don't take my AppMed insurance. What would it cost approximately?
And I would tell you that when you would come in and have a consultation, because I don't know. Okay? I don't know what that'll be. I promise you that we will put it within your budget, whatever it is. Okay? However much it costs. And Charlie will tell you, this is how many injections you need for us to be able to fix this area, and this is how much it'll cost. And then I will sit down with you, and I will simply say to you, tell me what you can afford on a weekly basis that doesn't intrude into your family's economics.
I will call in right now and make an appointment when you guys get the chance and get the phone again over the line. I'm listening. All right.
All right. Thank
you
you
very much.
Fantastic.
Thank you very much.
Thank you.
Thank you, Larry. Thank you, Robert.
Oh, perfect.
Thank you.
Love that call. Can you mention the number again, Mark?
Absolutely. You can reach and ask, for Desiree. It's 352-633-0473. You can let her know that you want, and you don't have to tell her all of the problems or anything else. Just let her know that you'd like your free consultation with Mark Shaw or Charlie Brooks for the PRP or weight loss or whatever it is that you'd like to meet with us about.
If you want to call in, you have about 3 minutes to do that. And just real quickly, there's a technical thing sometimes that makes it difficult for Mark to hear himself, I think. So that's why I lower you while the caller. I lower your call. So that's why the caller had to wait until you were done talking before he could ask another question. That's all.
Okay.
Since you talk about weight loss, that means that you are on the top of the nutrition end. Also, you'll be able to guide the people.
Yes, we will. 100%. And we have our nutrition and weight loss is obviously supervised by a doctor, and we get fantastic results. In our program, what we usually are seeing is about 35 to 40 pounds in men of visceral fat, not muscle mass, just pure fat that we help them lose that does not come back, like a roller coaster. Mm-hmm. With women, it's about 25 to 30 pounds of visceral fat that we're seeing during our program, and it's a 16 visit program where you're going to see us 16 times once a week, and it's not a difficult program at all. It's just that it requires a slight lifestyle change and understanding what nutritious, healthy foods actually are, and it's a great program. It makes patients very healthy. Diabetics, we've seen come down from 11 on their A1C down to 5.5, 6.5, right in there. That's huge changes. So it's a great program, and we're proud of it. So.
And I'm guessing, just to clarify, the platelet-rich plasma and the weight loss are two different things. There's no, you inject plasma for weight loss, right?
No, you do not. No. They still haven't figured that part out, Larry. How you inject somebody and then you lose weight.
Yeah, just so I want the listeners to know it's not the same thing. All right. Dr. Yordan's office again. The number is 352-633-0473. It sounds like Desiree is the person who answers the phone. And just say you heard about it on the radio, and if you could help us help them, maybe share the video of the interview that you're hearing. There's really nothing to look at. I think I just put the WOCA logo. Yeah, there it is.
Oh, absolutely. If you have a friend who's in pain and they don't listen to the radio, share it with them and let them know, hey, I heard this on the radio. We're happy to help anybody. It's a free consultation. That's the most important thing. Let us help you if you're willing.
All right. Do people come to you from all over the state?
Yes. Yeah. And we have many people who have come to us from Ocala. But yes, we've had people who come from, we are the representatives for the Foundation for Wellness Professionals in Central Florida. I'm the representation there for that. So yes, we have people who come from all over.
All right. Mark, thank you for doing this. I know that our listeners really appreciate it. And for the caller, that was an outstanding call. Thank you. And thank to Dr. Yordan as well. We'll be right back.
Fox News Radio, I'm Karen McHugh. Police in Tacoma, Washington responded to a domestic disturbance call yesterday. Gunfire erupted and one of those responding officers was killed.
After the shooting, the officer's partner radioed dispatchers with the news.
My partner's down inside the residence. Copy. Partner's down inside the residence.